So in this extraordinary time that we find ourselves in, what is the one thing you know today that you wish you knew 5 years ago?
Huh, that's a good question. Especially because I started that telemedicine company 5 years ago. That I know today. Let's see. I think probably I got to give you my honest answer, which is I already knew it worked 5 years ago. I already knew how valuable it could be even 5 years ago. I think that the obstacles that we faced were the regulatory obstacles in terms of reimbursement and all these crazy regulations that were there before. And now they've been dropped for the pandemic, which is great. And now there's an executive order, of course, keeping them active. But for instance, when I started my company 5, 6 years ago, what the Medicare beneficiaries had to do was get telemedicine from a place that was not their home,
Mm,
which is the opposite of what telemedicine should be.
right.
And so, it was regulations like that that really kept anything from taking off. But now suddenly the pandemic hits and all these regulations are just thrown out the window. And it's
Hmm.
really paved the way for us to move forward and expand telemedicine then.
That's
not,
yeah.
not the most graceful answer, but it's the
Oh, that's
truth.
great. And I just want to I'm just curious with your entrepreneurial spirit you have here. So like, what has been a major leadership challenge that you've had to deal with since this pandemic began?
So I'm really lucky because Dr. Alfonso, our chairman at Bascom Palmer, is such a technology fan, and he's been such an enabler. I mean, from day one, he said, Ranya, take the ball and run with it, and he basically cleared the obstacles for me so that we could really kind of push the workflow and the processes, because it's one thing to know it's a good idea, but then it's another thing to execute on it. And that was really the biggest, rate limiting factor. It's always been that way. It's just the process, because you have to sort of have your entire organization working together as a team and understanding the common goal. So it needs to go from your scheduling department, from actually starts at your website, for instance, or your call center, then your scheduling department, and then every person that the patient meets along the way has to have that kind of same mentality and understand why they're doing these things. But that's been the biggest hardship, I think. And it's not because people haven't caught on. It's just that it's just such a big fish,
Mhm.
to fry, to get everyone in an organization like Bascom Palmer, for instance, to all be coordinating and to change these, you know, processes that have been going on for a very long time.
Mhm.
But hey, we managed to do it. We did it in a pinch. Everyone pitched in, and I really thank Dr. Alfonso because he made it happen that way.
Mhm. So that's perfect. It goes right into my next question for you. What's been a positive that's going to approach the changes the way you approach the future of telemedicine?
Well, it's more, I think, the approach for any new technology. It's it's just, it requires a new way of thinking. And one of the things that I had, kind of been saying at the beginning of the pandemic was this is kind of a Darwinian moment for ophthalmology and for medicine in general. You either change the way you do things or you won't move on, you won't survive. And so, we have to learn to adapt if we want to survive. That's exactly what we all stepped up to do here. We've adapted to a new way of taking care of patients that's been really beneficial for them and for us. And I think that's the mainstay. That's the big take home point here is that, once we get set in our rigid ways, it's really hard to break out of those things. But as long as we keep innovating and keep adapting to the new environment, then we're going to be moving medicine forward.
Mhm. What do you think is one thing that ophthalmologists aren't doing now that they should start doing on Monday?
Thinking outside the box. As ophthalmologists, we are, we're very type A. We're very used to, we're very orderly. We like everything perfect. We like to see and touch and feel and everything. But this requires kind of a suspension of those old ways of thinking, and we have to stop thinking so concretely, and I think expand our ways of treating patients. So I would say just jump in head first, try a few visits, and then you'll see the appeal afterwards.
Mhm. And what are you most excited about in telemedicine technology?
It's not just telemedicine technology. I think telemedicine has now become sort of the watershed for other innovations. And so it's tied directly to remote monitoring, to artificial intelligence in medicine. All of these things are tied together. And so what I'm really excited about is kind of putting the whole picture together, which is we have better, smarter, faster ways to take care of patients anywhere in the world, anywhere they are, no matter who they are, and no matter what kind of access to care they have. We are now developing tools that can reach many more patients in a much more efficient and better way than we used to before.
Okay. Dr. Ranya Habash, thank you.
Thank you so much.